Hi Annie, I'm Jennifer Held. I'm going to be your nurse practitioner student today, and I would like to assess your cranial nerves if that's okay.
Yes, Miss Jenny, this is okay.
Oh, okay, thank you. Okay, I'm going to wash my hands. And all right, we're going to get started. So the first sense we're going to check is your olfactory. Yep. Okay, good job. Okay, now I'm going to have you close your eyes. And I'm going to, all right, ready? Close your eyes, and we're going to take a deep breath just with one.
Blackberry Rose.
Okay, and that is correct. And then I'm going to switch to the other one, and I am making sure also that her nostril is taut. So we're smelling out of just one.
Black cherry.
Black cherry is correct. Okay, and the next one we're going to do is your optic nerve. So we are going to do your visual acuity. The first thing I'm going to do is have you read the Rosenberg chart. So I'm going to have you, it's about 14 inches, so it's about a foot and a couple extra there. And tell me the furthest line down you can read.
A, C, T, P, N, L.
Okay. And then the next part is going to be what we love is the wiggle test. All right, so I'm going to have you there right at me. And I'll put my hands behind your head. And you tell me, with staring straight at me, when you can first see my fingers wiggle, okay?
Wiggle. Wiggle, wiggle.
Okay.
Wiggle. Wiggle.
Okay. Let me go down here.
Wiggle. Wiggle.
Okay. Table's in the way there, but that was sufficient. Okay. Now we're going to turn off the lights. All right. And I'm going to find your red eye reflex and check your pupils. All right. So I'm going to come in from the side. I'm going to have you look straight ahead, Annie. Kind of focus on probably that cup right there. Okay. And I'm going to come in. Well, so I can get this lined up here. Yeah, there you go. Okay, nope. Keep looking at the cup there. Okay, now I have a red eye reflex on her. Well, I had a red eye. Hold on a second. Okay. Keep staring straight ahead there, Annie. Thank you. Okay, I'm actually going to lift your... Oh, there it is. So now I have a red eye reflex going, and I can see her blood vessels. Ooh, lots more arteries and veins. And I can see your optic disc. Sorry, I did not mean to sound so excited there. Okay, everything looks good. No swelling, no pallor. Looks good. All right, we'll go to the next eye. All right, so now kind of just stare straight ahead, or you can stare right at my shoulder there if you'd like. Might be easier if you have something to stare at. Okay, I'm coming in from the side here. I can see her red eye reflex. Sorry, am I blinding you? All right, and I can see her vessels. And I can see more arteries and veins. And I can see her optic disc. Okay, all right, looks good. All right, can you turn the light back on for me, Annie? Thank you. So we did that. We checked your fundi. There was no edema, no pallor, no enlargement. It all looked good, no problems. We did the wiggle test. We did that. We did the visual acuity. Okay, the next one we're going to do, I don't need my book anymore, is we are going to check your optical nerves, cranial nerves, 3, 4, and 6. So I'm going to check your extra eye movement. So what I'm going to do is I'm going to actually I'm going to do this. We're going to do a little different this time. I'm going to hold up your eyebrows. Okay? And I'm going to have you follow my pen here. Here we're going to go over. Yep, just with your eyes. Not with your head. I'm going to go here. Okay, any double vision or anything when we're doing this? Any pain to your eyes? Nope. Okay. Looks good. No problems there with her vision. That's been that passed. No double vision. I didn't see any nystagmus. And I was looking at her eyelids. They're both symmetrical. I don't see any drooping. Nope, look pretty good. There's no swelling or anything. That's pretty good there. And now I'm going to move my finger. I'm going to use my finger. I'm going to put it right towards, just follow my finger. Follow my finger with your eyes. So I'm going to kind of do this to you, okay? Okay. Follow my finger. There we go. And back. I'm going to do it again. Nope, look at me. And back. Okay, good. All right, now she has cranial nerves 3, 4, and 6 intact. Now the next one is her trigeminal. We are going to check her. So I'm going to have you kind of clench your teeth, do that. Yep, I'm going to check your TMJ right there is what you've had me do before, your mandibular muscle. And now we're going to try your temporal muscle, which is very strong right there. And then the next we're going to do is I'm going to do the sensations. So Annie, I'm just going to show you on your cheeks. You can open your eyes right now. This is a soft touch, or this is a dull, and then this is a sharp, okay? So I won't hurt you. You just got to tell me whether you feel sharp or dull, okay? Keep your eyes closed.
Dull. Dull. Sharp. Sharp. Dull. Sharp.
Okay. One more there.
Dull. Dull.
Okay. So first I made sure I did both sides, and then I did go in kind of a different pattern to kind of throw her off in case she was thinking I had a pattern going there. We did the disc. I did the, this is also when I would do the corneal reflex. I'm not going to do it here, but what I would do is take a cotton ball, kind of make it a little sharp area, and do what she's doing there. Yep, and then I would be touching her eye, and I would be seeing the blink that I just saw, and that would be another sensation there. Like I said, we don't do that unless, because I don't want to hurt her. The next one is her facial, cranial nerve 7. We're going to check her facial symmetry. Looking at her face right now, I don't see any abnormalities. I see no abnormal movements, no involuntary movements, no tics. Her face is symmetrical. Well, not right now, it's not. All right, keep it straight, girl. So the next thing we're going to have you do is I'm going to have you show me your teeth. Do that. Okay, now I'm going to have you smile. Okay, I'm going to have you frown. There you go. All right, puff out your cheeks for me. Okay, and I'm going to kind of push on them. Try not to let me deflate your cheeks. Okay, normal tension there. Okay, so I'm going to have you squint your eyes shut. Don't let me open those eyes. No, I'm a pesky burger. Okay, open your eyes. Can you raise your eyebrows? And can you make your forehead a wrinkle? All right, good job. It was wrinkled a little bit there. When you raise your eyebrows, it makes it wrinkle too. Okay, we wrinkled the forehead. We checked the cheeks. Did okay there. Okay, and then I'm going to check right here. Actually, can I have you clench your jaw again? Can you kind of make this little face? Okay, and then I'm going to look down here, and this is normal and tense too down here. Right there on the top of her, top part of your throat there, huh? Okay. Okay, the next one we're going to do is her glossopharyngeal, which is cranial nerve number 9. And then we'll also do the vagus, cranial nerve number 10. First thing I'm going to do is her soft palate. So I'm going to have to look in your mouth for this. Okay. And so what I'm going to do is I'm going to have you say, actually just open your mouth and have your tongue just kind of resting there. Nope, put your tongue back in your mouth. There we go. Tongue resting flat in there. I don't see any raised areas. It looks symmetrical. It's not protruding or anything on its own. Okay. Next thing we're going to have to do is I'm going to have you open your mouth for me. Now stick out your tongue. And actually, I don't even need a tongue depressor for her. It looks good. I can see her. Okay, say ah. Okay, her uvula. All right. Okay, good stop. Her uvula goes up as needed. The soft palate combines there. It does lift up spontaneously on its own. No problems there. I'm not gonna do the gag reflex on her since I know she just ate. But what I would do is check the back of both sides of her throat and check for some that gag reflex that she would be kind of look like that. And that's it. Oh, cranial nerve number 11. So I would be coming behind her, just like so. And I would be touching both of her shoulders, which I'm doing. Okay, I'm gonna have you raise both your shoulders, shrug. Okay, I checked the tension in there. That's good. I'm gonna check right in here too. All right, go and put them down. And then the other thing we're going to do, I can't remember now. Okay, I'm gonna have you do an extra thing here. So I'm gonna have you push towards my hand. Can you push towards my hand? All right, and I'm seeing there, nice tense. Okay, other side too. And nice and tense. Okay, the last one, you get to stick your tongue out at me. So stick your tongue out at me. Beautiful. Okay, now put your tongue to the left. And hold to the right. Okay, any pain, any problem? It's midline and looks good. Cranial nerve number 12 is intact. Do you have any concerns or questions, Annie?
No, Miss Jen.
All right, thank you for being such a good patient.